Hi.
Good evening, everybody. And thank you to all of you who should be starting your leisurely evening who are joining us here instead. And that is, we are absolutely delighted to welcome everyone here. On behalf of the CSJ Center for Reconciliation and Justice and for the Sisters, and on behalf of the Sisters of St. Joseph of Orange, I want to welcome you to this year's annual CSJ Symposium. This year, the theme is Faces of Justice. From its beginning, the CSJ Center has supported the university's commitment to engaged learning, which technically is educational opportunities for students to work in community-based and social justice experiences off-site from the campus. The Voices of Justice project that you are going to see today is the result of this focus on community-based learning. It is also the result of a beautiful collaboration between the CSJ Center and the Theater Arts program. The Voices of Justice course, which this is the result of, is an interdisciplinary core curriculum course. It is offered by the Theater Arts Department, but it is composed of students from multiple disciplines, from varied backgrounds and majors. Half of these students may never have written a creative piece, and half of them may never have performed anything. So there's a challenge for everybody and a learning opportunity. This year we had 26 students in the course. That allowed us to work with half and half of them in two different agencies. Yesterday evening, we showed the performance from the group that worked with the Alexandria House in Los Angeles that works with homeless services for women and children. And tonight we have the honor to work with Providence St. Joseph's Health, the Mission and Leadership Institute. And in collaboration with them, we are featuring stories from administrators, caregivers, and COVID-19 survivors. So we welcome you to the Voices of Justice class presentation of the Providence St. Joseph Health Mission and Leadership Institute sponsored stories. Following the recording, the performance, which is just about an hour, perhaps a little bit less, we will invite the storytellers to come on screen, the people who from Providence St. Joseph Health who have told their stories. Some of them will be with us. Some of the students who were writers, directors, actors will be with us, and some of the program directors. So at this point, I am going to, and we want you to share, ask questions, whatever you need. There's the little Q&A place where you can write your question. There's the chat room, but we'll do that after the recording. So now I'm going to turn this over to my co-instructor, Doris Baizley, to give you a quick background on the nature and process that went into this storytelling project.
Thanks, Judith. I'm a playwright, and it's been now 10 years since Judith and I decided to design this program called Voices of Justice. It started with the idea, our basic idea was that the very simplest act of social justice begins with listening. And that's why I'm so glad to see tonight that the whole program of the symposium is called Listening, Discovering, and Transforming. And that is exactly the 3 stages of the way this course runs over one really short semester. The semester begins with our students going into a community, meeting people, getting to know each other a little bit, and then conducting one-on-one conversations, which they transcribe and bring back to, well, in old days, it was the classroom. Here it's their home. And they bring them back and transform the transcript of the interview into a piece of creative writing. And it can be it's a dramatic piece of writing, a monologue, a scene, a poem, a song. And that's the transforming part. And then, or it's also the discovering part. And then the third part is performance. And our students who are not necessarily theater majors, this is a core class for the whole university, perform the pieces. They speak the words of the person they interviewed. And in this way, they've gone through these stages of listening, discovering, and transforming. And our hero in this art form is the playwright Anna DeVere and performance artist Anna DeVere Smith, who says, to speak another person's words is like walking in another person's shoes. And I feel with this program, and particularly with the one we have tonight, I'm very proud of it. The work the students have done in all three of these fields has made this a really beautiful piece. So I think it's time to share it right now. And I hope you enjoy it, and we'll talk about it when we come back afterwards. Thanks.
I stumbled upon this career path. I thought, who would want to be a hospital chaplain? While I was in seminary, I had to take what's called a field experience. We're focused on theological formation and exploration, but at some point, each student is required to put it into practice. So what I did is I waited too long, and the only thing that was left was an internship at a hospital. And I thought, man, all I'm left with is this internship at a hospital. So no, I had no interest in being a hospital chaplain. But with great reticence and reluctance, I called the hospital and asked if I could be accepted into their internship program. And they accepted me. After I completed my first internship, I actually hated it. I thought, who in their right mind would want to be a hospital chaplain? There's weird smells, there's suffering, it's totally chaotic. And I walked away thinking, I never want to do this again. But I still happened to impress the supervisor, the manager of the spiritual care department, and he asked me to come back for a second semester. So I was like, wow, do I really want to do this? But I was kind enough to accept it because I figured finding another internship would be hard. So this was already there and I did it. And it wasn't as bad the second time. I thought, you know what? Okay, this is not as bad, but it's not for me. It's totally not for me. And after that, I completed the second internship, and the director came up to me again and said, hey, I'd like to offer you a per diem position, which means sort of a part-time kind of position. So I took it. It helped fund my seminary education, and I started to develop a more empathetic spirit than when I was first hired on. I started to feel connected to patients and families in their suffering. But I'll tell you, things really changed for me when I changed my theology. In the course of my seminary training, I started to discover Catholicism, and I became a Catholic. So my theology changed quite a bit. And once my theology changed, it gave me a better framework to understand suffering, to find meaning in suffering, theologically speaking. And it helped open up my eyes to become really empathetic and to become really understand what it means to sit with someone in their suffering. And so that really changed everything for me. Much later, after I became a full-blown Catholic, I rediscovered the hospital chaplaincy, and I was encouraged to do it again. I came back with a greater appreciation, a greater sense of empathy, and a greater sense of joy with my faith. My Catholic theology really provided the framework I needed to understand why I was there as a chaplain.
So, let me close my door real quick. always knew I wanted to work in prevention and wellness. I really knew I just loved the whole, that exercise is medicine. I had asthma as a young girl and they just medicated me like crazy and told my parents that I couldn't exercise and it was horrible. So I just got fat with steroids. And so for my body to just be stagnant, it was like miserable. And so, when I was about 14, I started working out and, I really could monitor my asthma through lifestyle. So I was very interested in health and wellness. And I got my degree from Pepperdine University in sports medicine. When managed care came out in California, I led the preventative care and health education department at Prime Care. So here I am, like this, sports med major from Pepperdine. And it was a Friday afternoon. And I got a call from a physician saying that all my educators are out and I have a stat diabetes consult. I need someone to come. And he goes, I just need somebody, Dora. So I go, okay, I'll come. So I went on this, it was a 16-year-old girl who was type 2 diabetic. And so I drove on this call to his office. And as I got off the freeway, there was like not a sidewalk to be found, fast food on every corner. And I get in and I start talking to this young girl. And she proceeds to tell me about her sexual abuse from her mother's boyfriend. And so, it was just it was like the big red truck moment for me where I said, okay, this is not working. So that's when I went into public health and started really getting educated around how do you incorporate the social connectivity? How do you begin to think about this in a more holistic way? So I became really interested in, whole person care, body, mind, and spirit, and also the complexity of public health. And that's when I began to work on my doctorate at Loma Linda University.
Nope. Yep. Nope. Yep. Nope. Yep. Nope.
I've been a lifelong educator. I was a school principal for, 11 years or so, kindergarten through 8th grade school. And that's a long time for any school administrator to be in one spot. And it's always good to be refreshing as you go along in your career. It's good for the organization. It's good for you. And I was just sort of like, this is a great gig. I love my community. But at year 11 or maybe year 10, I started thinking, what else can I do? And so I started looking around at other industries, and my husband was looking on LinkedIn.
Hey, look at this, Nancy. Chief Mission Integration Officer of Providence St. Joseph Health. That sounds like you.
The first year was hard. It was hard because I didn't know anybody, and it was an industry that I had never worked in. And so it was a little lonely just having to walk in and not have relationships. I'd say that was probably the hardest part, especially for my personality at first, because, I was really used to having a team. When you're leading a school, you can walk in and say, hey, Julie, how's Sarah's broken ankle? Or, you have those connections. And so that was hard not having that. And because my position now is regional, I don't necessarily have one team. I have, 100, 150 different teams that I visit. And so I actually made that comment to somebody one day, one of my clinic leaders, and I said, I just feel like a visitor everywhere I go. And so she goes,
no, Nancy, that's not true. You have 150 families everywhere. Like, these are all your families. You can walk in at any time and know that you're part of that group.
But now I really do feel like that. Like, I have 150 families. Those relationships have helped me through this pandemic. Especially, when the fire started this year, where I really started to feel it emotionally was when I couldn't even open my window. You know, when the air quality was so bad, it was crazy. I mean, you know, it's like The Walking Dead or something. It's an apocalyptic movie. Because in Northern California, we don't really have autumn. We have fire season. And I mean, good grief, we're sort of getting used to this, but we were hit really bad back in 2017. 153 employees lost their homes. And shortly after that, we were sitting around and we're like, you know, not everybody can donate money to help, because some of our caregivers, you know, they're frontline and they make minimum wage. You know, the average medical assistant can't replace somebody's home, but they want to show that they care. So, you know, they want to show our organizational values of compassion and integrity. So we got this idea. We wanted to make comfort kits, and I think I might have seen it on Pinterest or something. But basically, these comfort kits were plastic gallon-sized baggies that contained things like chapstick, granola bars, tea, comfy socks, and essential oils, and a little card we put in them. And basically, the message was, you know, we're thinking about you. We know we can't fix things. We know we can't make it all better, but like, we really care about you. I think that self-care stuff is just really important. Just finding whatever it is that nurtures your soul is extremely important. So we put these donation boxes out all over these medical clinics that weren't affected and told people to drop the little goodies off. And you know, we started doing these packing parties that got everyone really involved. And we collected a lot of little goodies. And we must have created 1,700 comfort kits. So to deliver these, I actually rented a van. And, you know, I really wish I had a picture of the van. But my husband, I don't think he will ever forgive me for this. So he's like,
Oh my God, the cost of the van, Nancy. Like, you could have just gone out and bought those things up there. Are you really going to drive that far with a van full of cozy socks?
but the whole point is that these caregivers felt empowered now. They felt like they were doing something.
So we drove that darn van from Anaheim to Napa.
And we packed the van to the brim with comfort kits. I would deliver these and say, these came from Anaheim. You know, they want to do something for you. Here are these little comfort kits. And, you know, imagine how important they felt. The caregivers there would open these bags and go,
wow, this is from our own ministry. Medical assistants and receptionists in Anaheim packed this.
It was like a grassroots effort that was really hands-on, and it made everybody feel like they could do something. I got a message from one of my managers up in Humboldt the other day, and she was asking me about the project.
Nancy, remember when we did the comfort kits? We want to do that. We want to provide comfort kits. So what do you think? What should we pack? Can I have the old flyers? You know what? I want to launch this. It may not just be our caregivers that are going to receive them, but we can give them our firefighters, and we can give them to folks out in the county that are really fighting these fires.
I was just so happy, just as a leader, because one of the greatest lessons is, you know, it's not about you doing the work. It's empowering other people to do the work. And that will really bring out their best selves and their skills and their talents. And, you know, in some ways I was frustrated that I wasn't going to be able to go up there to help lead it. But at the same time, I was like, you know, Carrie, you know what you're doing. You got this. This is awesome. Go for it. And so she's like leading it. She's creating flyers and she's doing this, and they're launched. They put boxes out at all the clinics, and they're going to repeat the whole effort. And I'm so glad they're doing it again, because especially now during the pandemic, I just want everyone to know, like, you are not alone. You are in this with people who are also hurting and suffering. And whether it's physical pain or emotional pain or spiritual pain and isolation, it just breaks my heart to think that anybody feels like they're by themselves. And, you know, is it going to change the world? No, it's not. But is it going to make somebody feel like I'm cared for? Absolutely.
have a lot of issues as a Catholic healthcare entity. It's misconceptions. Oh, they're a Catholic system, so they're not going to do this. Oh, they're on this side of this issue, so they don't support that. So really navigating those misconceptions, how we do that is we always lead with our mission, which is to care for the poor and the vulnerable. So if we're talking with a Democratic lawmaker or a Republican lawmaker, even though we might disagree with them, they understand where we're coming from because they know it's grounded in our mission to care for the community. But that was pre-COVID. I'll tell you what, I couldn't believe the things I saw and the things I heard during this crisis. The biggest thing was to get the government to act fast, which government moves at a glacial pace. We had at Providence, we had the first COVID patient in January. First COVID patient in the US was in Washington State in January, and then in Seattle. Seattle was really the first big city to be hit. You know, then it kind of migrated from Europe and then it came to New York. But so we were I was standing up and down, waving my arms, jumping up and down, you know, saying like, this is a huge issue. We need supplies, we need testing, we need PPE. And the country was like, oh yeah, whatever. So we were like, I sent an email to our senator, right? Saying that we were running out of PPE. COVID numbers are doubling, right? We're going to run out of ICU beds. We're going to run out of everything. And then that email got forwarded around. And then I got a call at around 10 o'clock our time, 1 a.m. DC time. And it was the Washington Post. And they were like, we got your email. We understand things are really bad in Seattle. What can we do to help? So then there were articles written on it. And I spoke with the Wall Street Journal and with like the New York Times and about what we needed. So I really think our biggest challenge was elevating the crisis at the beginning because people didn't understand how bad it was going to be. And then there's kind of this attitude of the federal government that we're like, well, you're on your own. States, you're on your own. And so we're in 7 states dealing with multiple state processes around PPE, helping all of our leaders navigate how they access ventilators, how they access N95 masks, and how you do all of that. My job is I had to go to our leaders to see, okay, how many ventilators can you give me? And this is the reason why we need them. Which, what I do is lobbying. But you have to lobby internally and externally to really make the case to our leaders. So we ended up donating 500 ventilators, and 50 of those ventilators were used at the beginning of August for a hospital in Texas that had run out. So my job is to make sure that we're helping our whole hospital community and talking leaders into doing things that they don't want. They want to do it because they know it's the right thing, but they have to like mentally get to that spot, you know? And I forgot the best part. There was an issue. We were trying to get the Navy ship that was docked in San Diego, the USNS Mercy, up to Seattle. And then working with Governor Jay Inslee to get it up to Seattle because it was promised to Seattle. And then suddenly Governor Newsom is like, no, I want the ship. We need that ship. We have all these people in LA. And we were calling the Admiral of the Navy saying, we need the ship. We have this many people. And then Governor Newsom was on it. And then we were like tweeting about it. It was a whole thing because we were even talking to the Secretary of Defense. So they were like fighting over like who was going to get this ship. And ultimately we got in Seattle field hospitals. Providence either way was fine because we're in LA and Seattle. And we ended up getting FEMA to send field hospitals to Seattle. 5 field hospitals, and then the ship went to LA. And guess what? Neither were ever used.
You ready for bed?
Yeah. Hey, Dad, Can you tell me a story about your work?
Yeah, of course. Well, it's tough. I have the responsibility of trying to keep all of our providers in a good headspace, keep them engaged, you know? I left the for-profit, fast-paced world to come into something where I thought I could maybe make a difference.
Uh-huh.
It's tough to make sure we're providing all the things they need in a time period, where you're not nearly getting the revenue that you're normally getting. It's tough, when when there's an immunization available, who goes first?
It's tough.
It's tough. There was a supply shortage and there was a lot of fear. Like, are we, gonna have enough masks, enough gowns? It's tough. How do you prepare clinics for patients that are coming in that have, COVID-like symptoms, and they're mixed in with patients that are just, there for something else that's unrelated to COVID? So we had to create a lot of different specialized clinics that were like tents, and in areas that patients that had illness-like symptoms, for them to come through and, screen them.
Tense. Like camping?
Sorta, yeah. It's tough. We had to do a lot of logistics and help and, yeah, make big changes fast. Fix your pillow. I don't, that's gonna hurt your neck tomorrow morning, and then you're gonna complain to me. I don't wanna hear that. You know, it's tough. Part of the work is, we do a lot of team building stuff. We obviously do reflections a lot, and we just try to center people and, say, okay, let's not talk about COVID at this point. Let's not talk about clinic operations. Let's just have a conversation about how you're doing. Like, share something, like with what's the craziest thing that has happened to you when you're working at home? Because it's nuts. It's tough. So just try to make opportunities for people. Just open up and, share and just lean on one another and just be human. And let's just stop trying to be robots. There was a point where we were meeting at like 6:30 in the morning and trying to make sure supplies are getting to the right place. And like you start to just lose your mind. It's all just, tough.
I don't want to go to school tomorrow.
It's just online.
Hey, Dad, what's immunization?
Well, basically, an immunization is
I like mommy's stories better.
yeah, I do too.
It was shocking, disturbing, shocking, scary, pandemic. He was my patient, one of the first diagnosed here at my clinic. A semi-homeless man, worked at the airport, lived in his car. The ER diagnosed him, released him alone, sent him away to a motel. He had no home. I learned of my patient alone. No process in place for his care. How would he get food, water, medicine? He was alone, locked in a room. Would he leave, infect others? It was up to me, my leadership, to bring everyone in line, learn how to care for this patient, for a member of this community, where he was not alone and he did survive. My first patient, such a heavy experience, as though the weight of the world were on my shoulders. A pandemic. And this was only the beginning.
God.
It'll get easier after physical therapy. Your muscles will be weak since you haven't used them in 9 days.
What do you mean? What happened to me?
Oh, Darren, I'm so sorry. I thought they already explained everything to you when you first woke up.
No, not really. I mean, I think maybe they did, but God, I can't for the life of me just remember right now.
Well, don't worry. I'm happy to catch you up. This might be difficult to hear, though. Are you sure you're ready?
Yeah, I'm ready. I want to know what happened to me.
Of course. I completely understand. Essentially, you are our very first COVID patient here at St. Joseph's Hospital.
What? That can't be true.
Yes, I know it's hard to hear, but you are actually really lucky to be our first patient. Well, as lucky as someone in your situation can be.
Wow. I just can't believe that happened to me. I mean, me of all people.
You were put on a ventilator for 9 days. That sounds bad, but you were lucky because right now our hospital is full of COVID patients, and there are more coming in every single day. We know much more about the virus now, but when you first got here, we had the resources to focus on you. I believe that was a huge reason why you survived.
I know you probably aren't supposed to tell me this at least right away, but it's all I can think about. So did I almost die?
You deserve to know the truth, and as a medical professional, I would never hide it from you. There were times when we didn't know if you were going to make it. You kept fighting, and you never stopped. You were on the edge of death, but you came back every time.
Gosh, I had no idea it got that bad. I mean, you keep saying I'm a fighter, but I can't pick up a phone right now.
Don't be so hard on yourself. Like I said, being on a ventilator for so long weakened your muscles. You're also likely going to have to go through a lot of tests in the next few weeks to make sure that the virus and the ventilator didn't do any long-term damage. It's going to get better, Darren. But keep in mind, the hard part is just beginning for you. I'm sorry. This is a lot to put on you right now.
No, thank you. Thank you for your honesty. My God, my poor family.
Speaking of your family, I believe it was your wife on the phone call you missed earlier. Here, let me help you.
Right, thanks. Oh, and before you go, I just wanted you to know that your kindness is something that I will remember forever. I don't even know what to say. I mean, you and the rest of the staff, you've saved my life, and I will never be able to repay you. Thank you. Thank you for everything. I mean, really, thank you.
Darren, repaying us is the least of your worries. This is what we do. None of us signed up for a global pandemic, but that does not change our willingness to put down our lives for the health of our patients. It's nice to get a thank you, though.
Hello? Darren? Are you okay?
I'm fine.
Oh, thank God it's you. I was worried when you weren't picking up.
I'm so sorry to worry you again. God, it's so difficult to do anything right now. My hands are like jelly. Believe it or not, I dropped the phone when I tried to answer it.
That sense of humor coming back is how I know I have my husband back.
A nurse, actually. She helped me call you, and she explained everything to me. I finally understand what happened now. It must have been so difficult for you when I was on the ventilator, and and worrying that each day could be my last?
Of course, it was difficult. Thinking you might never wake up. I didn't want to imagine losing you, but I had to. I had to call the insurance company and talk to them about life insurance. I had to tell the kids why you were gone. And I couldn't even be there with you. I felt like you were completely alone. When you started getting better, it was the best day of my life. The staff at St. Joseph's were our saviors.
Yes, yes. And that became so clear to me as I spoke with that nurse. Oh God, I didn't even get her name, but her kindness, it changed my perspective. I mean, she was so compassionate, taking the time from just the hell that she must be going through to explain to me what happened and to help me to help me use this phone. I don't know if she's a woman of faith or not, but in that moment she was God's presence to me. The whole staff, they have all been God's presence to me in a time that I have desperately needed God. And I'm not isolated here or alone because I'm surrounded by that staff, and I'm just eternally grateful to the people who've healed me.
Wow, there are so many stories. My goodness. As recently as today, without trying to violate what's called HIPAA, you know, incredible. Today would have been a good one to share, but it's so fresh and there's so many details to it. I guess I'll have to share this one. It wasn't as recent as today, so I'll have to think back a little bit. Um, as you know, COVID has changed people in incredible ways. It's even changed the way we provide spiritual care. Before, we'd be able to provide patients with without really any limitations. We'd just be able to walk into a room and expect to see family members, expect to see people at the patient's bedside, and that's no longer the case. There was an instance where there was an end of life situation in which a young person was actively dying as a result of COVID. This young person was unable to have family be with them in the bedroom, and that's when patients need to be with their families as they are transitioning, as they are actively dying, and they were unable to have that interaction. The staff finally made an allowance to allow this patient's significant other to be with this actively dying patient, but the significant other really thought that it would be important for family members to participate in some way. Well, they couldn't be there physically for several reasons. The hospital policy was not to allow any visitors to prevent the spread of COVID and just to keep things very, very simple. So what we had to do was, instead of having a large family or a group of family members by the patient's bedside, we had to be creative, utilizing different video chat platforms. So what we did in this instance was we actually did a Zoom call at the end of the in this patient's room, because I myself wasn't actually allowed inside the room. I was outside and trying to orchestrate this end of life ritual they asked me to participate in. I have this patient's significant other at my side and the entire family. It was a large family. There were people from all parts of the country who wanted to be there, who couldn't actually be there, part of this Zoom meeting right outside, right at a window of the patient's room, which was a glass door. And this, in my phone over here, was able to orchestrate a liturgy that was congruent with the patient's respective faith tradition. And everyone who could be there, who wanted to be there, who couldn't be there actually, was there over Zoom. Though this patient was unfortunately not alert and oriented, so but it brought comfort to the patient's significant other. And I apologize if I may sound vague. I'm trying to avoid pronouns, but that's one story of many that will never leave me.
Okay, so on March 15th, 2005, I was actually driving to a class at Loma Linda, and I was listening to the radio. And I heard about a terrible accident on the 10 freeway. And it was involving a fire truck that had been hit by a tour bus. So I called my husband. This was before cell phones. And so I called my husband at the fire station, and they said, Dora, who told you to call? And I said, they didn't. I heard on the radio, and I was just calling to see how Tom was. And they said, are you alone? And I said, yes. And they said, let me call you back in 5 minutes. Could you please find somebody to sit with you? And they called back, and it was the captain. And they said, Tom's been hit by a bus responding to a call on the 10 freeway. And you need to get to the trauma center as soon as possible because they don't expect him to live. So, the professor that I was sitting with drove me to the hospital. It was a tour bus that was going to a casino, but hit the fire engine at 80 miles an hour. And the tour bus, there was, multiple patients on the tour bus. And when I got to the hospital, they were in lockdown for disasters because there were so many. And so I sat on the floor of the waiting room entrance just sobbing. My daughters were 7 and 10 at the time. And so they finally let me in, and they said he's had a traumatic brain injury, that his lungs, they couldn't inflate his lungs were crushed, and named God knows what else. And it was such a violent accident that it was on CNN, it was on Fox News. And so the press and everyone and their mother were there, and everyone said, what can we do? How can we help? And I was just a mess. And, I was trying to keep my kids away because I didn't know how to tell them. And I said to Tom's brother, ask people if they'll pray. And that's what went on CNN for 3 days. So I literally got a tub. I probably a few feet wide by 4 feet long, filled with cards that people sent me that said they were praying for my husband. And people did fundraisers because they thought he was going to die. And about 2.5 weeks later, he came out of his coma. And they started intensive therapy. Again, no one expecting him to walk or talk, so slowly started making improvements. He was paralyzed on his left side. After about 6 weeks, I said, I want to take him home because it was just exhaustion. You can't even imagine the exhaustion. And so I brought him home and said, I'll take him to therapy every day because I just wanted my girls to have some type of normalcy. And about after 4 months, he started walking on his own. He started eating on his own. I made a pretty, with my background in physical therapy, like they called me the hawk because I was relentless. I was on top of his care. I said, failure is not an option. And within 7.5 months, we were preparing for him to go back to work. Within a year, he was back to full duty. I incorporated everything that I'd ever learned about healthcare, that it's community-based, that it's about social connectivity, it's about proper nutrition, it's about appropriate care at the right time. Tom was a miracle. but people had raised money thinking he was going to die. So I had all that money and I started a non-for-profit organization called Partners for Better Health. And it was about, really creating a new system of care that is more holistic. How can we create conditions for people to heal, for people to be healthy? So that's kind of my love. I always say that's my ministry. So it's pretty exciting just to see how things have come full circle. And last December, my husband retired. So 30 years in the fire service, full service retirement. I'm not saying everything's perfect and easy and all that, but he does well. He does really well. My kids, Katie is 23 and got her degree in psychology. And then Rebecca is just starting her master's, specializing in the public and nonprofit sector. So I feel like, wow, okay, 15 years and I did it, It's like, thank you, God. And now, just really thinking about with all that, what am I to bring to the world in my next chapter? It's about inspiring the next generation to not think dismal or we can't do this, because we can.
The story of my life. Let me see. I guess the best place to start is the story before me. My parents, they immigrated from Mexico in the 60s. They were brave. They were ready to go, ready to fight for their dreams, an unstoppable team. And then they had me. I grew up in a high density apartment building, but I'll stop you right there because that place was fulfilling. The rich culture of the undocumented spilled from the walls, a community to catch you right after you fall, a community that struggled. And ever since I was small, my family and I would answer their call. I loved my community. I loved them all. No, it wasn't a mansion or a fancy estate, but within those walls, I learned something great. I discovered that my voice holds weight. I discovered my power to create, to advocate. I discovered my fate. I wanted to help others, but needed a foundation. Immigration. A lawyer, I suppose, but deep down, the cons, they outweighed the pros. And then came the post office. I questioned my choices. All I wanted to do was give a voice to the voiceless. Will I be a lawyer? Will this help others? Or maybe this is a job that's meant for another. Stacks of applications swallowing me whole. It takes a toll. This decision won't sit well with my soul, so I fold. And the applications fall into the trash. You may think that's rash, but I don't. I think that's life. I won't be a lawyer, so I say goodbye. Then suddenly healthcare catches my eye. My degrees are in history and poli-sci, but I will not leave these communities high and dry, so I'll try. I moved to Brooklyn with my husband to answer the call, but a week before school, I had a terrible fall. I slipped off the stoop of our building, had my foot reconstructed. All of a sudden, my life was obstructed. In New York City, getting my MBA, confined to a wheelchair. What can I say? I was afraid. All I could do was pray. It was a reminder that my learning wasn't done. It wasn't fun, but I learned something true. You've always helped others. Now let others help you, and you'll get through. That's what I remember. I was out of the chair in the snow in December. So yeah, COVID-19 played out and we were still learning what it all was about, but without a doubt, I said, it's coming to California. It's coming. So how do we prepare? How can we be there, ensure we're all treated fair? How can we care? We don't have all the money in the world, but we needed to support the community. No one has immunity, but everyone needs an equal opportunity. What we need is unity. So we brought in a number of funders, health systems, foundations, donors, scholars. We put down $100,000, a starting amount, and the money speaks. Their interest peaks. We raised $4 million in just 6 weeks. It was amazing what we could do with the proceeds. They went towards stipends for families and other basic needs. We succeed. But there are still those in need. It seems to be the worst year of the decade. The pandemic, the fires, the racism displayed, sick families relying on Medicaid, it's a lot. And it won't be solved with a Band-Aid. COVID-19 played out. I'm doing all I can with what we've been advised, but it's hard. And my immune system is compromised. Cancer. I had cancer. Chemo. I did chemo. So that human connection is just out of reach. I want to get coffee with colleagues, go to the beach. I miss going into communities. I miss the outreach. COVID played out. A new normal begins. A life raising my beautiful 3-year-old twins who are both bilingual and both Zooming for school. So that's been cool. During this time, I think what we need urgently is to ask ourselves, what do we want to do differently? After the pandemic, the virus, the sustained isolation. And the truth is, it's up to your generation. The future of the nation stems from your future creation. But I have faith. You'll be our salvation.
The question is often posed to me by family and friends, like, Joshua, how do you do this on the day-to-day? Well, just to put it out there, it's not actually that intense every single day. I would say hospital work is the most unpredictable type of work. You can be in one moment providing a blessing for a baby, and you can be called to a code blue, which is a patient experiencing full cardiac arrest. And the patient can die, so you're there providing support for families that are grieving. We're subject to our own fears and concerns, you know? Where are we in this pandemic? What's the state of our health as a country, the state of our health as our hospital? So, you know, while we're providing support to our staff and patients, clinicians, chaplains are also in need of that sometimes. And we get that support from each other, our community, and through our own theological reflection. We're there for each other too, because we're on the front lines too. We have our own moments in which we experience fear and sadness and fear of the unknown. But the way I cope with it, I've become better at self-care over the years. It wasn't always the case in the beginning, but I've progressed through my profession. I've become more aware of who I am. For me, I really enjoy solitude. I think there's a lot of power in silence. And then, of course, there's regular stuff on the day to day, taking walks. My prayer life certainly helps. And, I'm a normal person too. I'm into Cobra Kai. I don't know if you know what Cobra Kai is. And I spend time with my family. I have great family support. I have great siblings. I'll go see my brother in Las Vegas, go see him, go see my sister, my nephews, hang out with them. So, just spending time with family and getting lost. Final thoughts would be, chaplains are there when patients and families need us most. I'd say we are like the army who sits vigil for when patients need us. Nurses and doctors are there to make the initial assessment. They're very busy, very in and out. Sometimes patients need more than just that from a clinician. They need someone to sit with them. Doctors are the Marines, in and out. We're the Army that stays behind. We're there to listen to patients' stories and help them process. Healing is not just about physical healing. It's about emotional healing, spiritual healing, and of course, physical healing too. That's our job as chaplains, healing.
When talking to Father Gregory, I noticed two things. One, he talks like a priest with that comforting, familiar cadence that makes everything easy to listen to. And secondly, that he always answered questions about himself with stories about other people.
When I got into an accident at work and lost my leg, I thought my life was over. All of a sudden, my entire life changed and I thought it was for the worst. But, Father Gregory helped me stay true to my core, to embrace the struggle, and to see where it leads us. And I eventually actually wanted to get a prosthetic. I didn't want to go back, but I wanted to move forward into the light that Father Gregory showed me.
I've been through treatment after treatment for my cancer, and the fact that I'm living is a miracle. But this being home all the time, I know it's safe, but it's very easy to feel alone and hopeless. I'll text Father Gregory every so often, and he always asks me, where is the light? What do you hope for? And I always have the same response: my roses. I can go to my backyard and trim my roses. And it's those simple things that make things easier. Father Gregory always reminds me to find that little light.
I wrote a letter. I didn't know what else to do at that point. I hadn't been able to see him since this whole pandemic began. And I said, my husband is dying. Please, is there anything you can do? I just needed to see him. Father Gregory heard about the letter and he was able to move my husband into a room where I could finally see him. It's just Father Gregory saw me as a person who needed help. And he was able to take away all this politics stuff so I could safely see my husband. Father Gregory saw me in need and reached out his light.
He also shared with me some stories about physicians working through the pandemic.
So I was talking to another physician who said that they wanted to take some time off during the pandemic because, they were scared. And so I asked, what are you scared of? And they said, well, this pandemic is just the worst of human illness. And I said, well, why did you become a physician? What do you mean? We became physicians for when it's not wonderful. And that's our mark of service. I told Father Gregory this, and I told him that I didn't think I'd been kind. And he told me that I was living out our oath. He said, you cared for him, you eased his way, and you reminded him of his service. And I guess he's right.
But Working through this pandemic has been hard, isn't the right word for it, but there's been a specific toll on my family. When I come home, my kids and my husband are waiting for me, and I immediately strip out of my clothes, which I throw in the wash, grab my robe, and I shower immediately. I walk out of the shower, beet red. My husband tries to joke that I'm trying to scrub off the first layer of my skin. And I am. I'm so scared for them. My biggest fear is contaminating them. Father Gregory knows this. He knows it's hard. And he's been able to set up a buddy system so everyone is checking in on each other outside of work stuff. I can have at least one conversation a day that isn't about work stuff. Something more lighthearted.
He also shared with me another story about an orthopedic physician working through COVID.
An older orthopedic physician, one I worked with in my office, who was always there to listen to other caregivers when they were going through hard times. One thing he always did was walk patients back to his office, one of his favorite things to do, but with COVID, you know, he wasn't able to do that anymore. One day, he said to me, sort of out of the blue, you know, marriage can be really tough at times. And I said, yeah, it can be a challenge, but, you know, you talk it out and work it through. It turns out a week later, he committed suicide. It was just so horrible and upsetting for everyone involved, even though there's nothing anyone could have done. It's hard to be the one who didn't notice, to feel like I was the one who failed to care, but
Father Gregory saw this as a deeper reminder to ask ourselves if we are checking in with people during this pandemic. Because if we are checking in, we might know more of the story. And the story could be the catalyst to listen to someone and to care for them and ease their way. As we were wrapping up, he told me one more story. He showed me the ring he was wearing, his maternal grandfather's ring. And he told me how his grandparents lived through the pandemic of 1918. I mentioned how it was funny that everything sort of comes full circle like that it's sort of comforting that things line up. And he said, well, now that you mention it, my maternal grandmother's name was Emma, which is my name. So I can't help but think about my story with Father Gregory's stories, that this conversation was supposed to happen, that I was meant to see this light at this specific moment. Because I am going through the grief of losing a friend very dear to me. In the midst of feeling just the crushing weight of hopelessness and believing that nothing is ever going to get better. And Father Gregory was there. His stories helped me find light and hope when I thought there was none left to be found. Stories stick with us like that. Father Gregory's story is going to stick with me like that. And we should all stick with each other like that, as we all try.
We all try.
We all try.
We all try.
to find this light.
Together.
Together.
While we're waiting for people to be admitted onto the screen, the storytellers and the students. Rex? Okay. We will, sorry, we've got noise coming in from my place, I think.
It'd be your phone.
No, it's not. Dory, do you want to take over a minute and let me take care of this?
Sure, I'd be glad to. Okay. I'm unmuted now, right? Okay, great. Michaela, hi. You guys, I hope we're going to get more people into our room. Oh, fantastic. Okay, we've got Rosie. We really need to have more people in our room because I just want you guys to talk. It was so moving, and I haven't seen it, for 3 months. And I have to say that at first I thought maybe we would be doing something that was about past history. And oh man, it is so not past history. So Emma, come on in. Let's all get in here. This would be great. Michaela, Emma, your work, you students, Eva, it was just absolutely beautiful to see you stepping into those voices. I can't say any more. I want everybody to talk about what the experience was like for them. And that could be storytellers, that could be students. Take off your mutes and let's hear from you.
I want to introduce Rosie Perez before we get too far because she is our coordinator from Providence St. Joseph Health from the Mission Leadership Institute who pulled everything together for us. We've got a phone going somewhere and we don't know where it's from. So it's not here. So I don't know where it's from, but we'll deal with it. Rosie, do we have some of your people that are going to join us?
I hope so. They said they would. I did hear from Darren not too long ago that a family situation came up, but Nancy should be on and Gregory and some others. But
we'll watch for them.
Yeah.
Well, meanwhile, we'll let you talk for them. And Dory, I'll turn it back over to you because I think we know what the sound is now. So.
Sure. Oh, wow. I'm looking at the chats all of a sudden. Okay, we've got a whole bunch of chats here. So one of the things I would like to do is thank Providence St. Joseph Health for letting us talk to your fantastic people. And I would like to know now, just to hear from the students who I feel like I haven't seen for a year because COVID is so weird. Tell me what it was like for you. What was the process like for you? Eva, Michaela, Emma, we can see you. Tell us, talk to us.
I was really, I guess, just amazed by how different everyone's stories were, relating to their position and just themselves as people, and how our storytelling processes, we started with interviews. We found our storytellers and we interviewed them, and just how you find these stories, these people have these stories that you aren't even really like looking for in particular, and they just come out, and it's amazing to see in so many different people's stories like how that happened and how there's so many different subjects that were covered.
I agree. I think one thing that it's like when you're talking and you're having this interview, it like feels like a conversation and it feels very natural, but then it's not until like you go back through the transcript and you realize and you like to start like realize where the story is, and you start to see like the common themes of what you talk about through the entire interview. And I think in the case of Father Gregory, we talked about so many stories and we talked about so many things, but there was like the theme of healing all the way through. Like every story he told had an aspect of healing a part of it. And yeah, so it was weird. Like you don't find the story until you start like looking through the transcript. And it's such a wonderful process to see it all come together and to like work with all the students. And yeah, it was so much more than it was so much more of a class than I was expecting it to be. I didn't expect to make something I was so proud of, I guess.
Yeah, I definitely agree. I think it's so interesting to, go from that initial interview to really taking on somebody's story and becoming so familiar with it, like every detail. And it kind of like it's your story, but it's their story. And it's just kind of like everyone's story because now you're sharing it. And it's just, such a enlightening process. And I definitely learned a lot about this specific, healthcare system and these people who are just so brave and doing amazing work. And I think that they deserve for their stories to be told. And I'm glad I got to help with that.
I need to cut in just a second. Stephanie, apparently Nancy and Gregory are waiting to join. Do we have a way of getting them on? And somebody asked if it was recorded, and yes, and we will be providing Rosie with a version of this, and it's also on our website, which we'll have Stephanie post so that you have that. Okay, back to you guys. Sorry for the interruption.
So Rosie, what was it like for you knowing all the people who were actually interviewed?
Well, I was just so excited to approach them about participating because I knew they all had interesting stories. I mean, to be a physician, treating the first COVID patient coming in and not knowing anything about it and trying to address the needs and the concerns and then realizing that this is something that is going to spread and have this impact that we've all been living with this past year. It's just incredible. And, I think about Allie and having to deal with all the political issues and all the advocacy and oh my goodness. I mean, she just was giving you just the tippy top of, a lot of what she does and given her experience and her background. I think we've been successful in part because we have people like Allie kind of really pulling for us and being the voice for everyone that got interviewed today. And so I have the pleasure of working with Nancy and Gregory and they're just wonderful people. They're friends, they're colleagues, they're, coworkers, and they do fantastic job. And I know that because when I tour and visit the other ministries, they'll tell me, oh my God, they'll tell me stories about them. And I'm kind of like, I know that they're capturing the stories of others. And I think it was a wonderful opportunity for everyone to kind of come together and share. And I think this opportunity to work with the students and to have this recorded was a great opportunity just to have someone else listen to what they were experiencing. And so this is going to sound a little goofy, but I'm a big fan of sci-fi books and movies. And there's always this one moment where somebody comes across, some kind of archive of a recording or a message. And I hope that this will serve the future in some way to show how compassionate our caregivers are, to be able to show what it takes to be able to do this kind of work, the grit and the resiliency. And I'm just happy all around, and I'm just happy that I get to work with them on a regular basis. So thank you. Thank you. I see that Nancy and Gregory have joined.
Yes, and if you guys would unmute and bring yourself on video, that would be wonderful. And Erin, join us on video, that's fine. Oh, there she is, okay. She's under Erin. I also noticed that Martin has joined us. Rosie, if you'd like to introduce him. Martin, of course, is the director for the center, and sleepless with no sleep at night with a new baby, right? So Rosie, I'll let you do those introductions.
And Aaron,
one more thing. Those of you that have questions, there's a little thing at the bottom of your box that says Q&A, and you can type your question in, and we will watch for it and share it with the people that are up here as panelists.
Thank you. Yes, Martin has joined us, and Martin Schreiber actually came to me. Martin's our executive for the Mission Institute, and he's had the opportunity to have sunseeing sessions, also listening tours, going around to the different ministries to see, what are the needs that need to be met as far as, supporting mission leaders, helping mission leaders transition into different positions, or even having conversations with those that have not had that mission background. I kind of think about Joshua's story. I don't want to be a chaplain. But yeah, I want to be a chaplain. And so, Martin is one that helps people discern that and to see, what path they want to go down. And when Martin approached me about this project, I was kind of like, okay, it sounds like a fun thing to do in the middle of this pandemic, something to take our minds off of it. And if I had known then, how heart-rending and just emotional I was going to get listening to people's story. I don't know. I probably would have given it a second thought, but Martin, please jump in.
This is an incredible moment as we try in some ways just to reverence other people's stories in a pandemic where there's been not an ability to always voice this. And so I want to thank you for really giving us an opportunity to tell the truth. Sister Judith, when you, Dory, and I began this, we said we'd go fishing. And I would say we have caught some amazing fish tonight.
Oh, yes.
I mean, we have just been able, in a way, and I applaud the big ones, but I applaud the students for their courage and their ability to really allow another voice to come through them. This is what I feel empathy is about. And so at the Mission Leadership Institute, we look forward to continuing these partnerships. So thank you.
I'm going to slip in before we bring Nancy and Father Gregory and the rest of you in. There are two questions. One, very quickly, Rosie, can you provide a video when you receive it so it can be included in SoCal Core Leader and Caregiver News? That's by Renee Petro. And another one was, I wonder, oops, wait a minute, it just disappeared. I wonder if any of the students were actually impacted to pursue a career path of the caregivers they worked with. This was excellent. So two questions just floating out there, and Nancy and Father Gregory, all of you just come in whenever you want.
Well, I'll jump in. I just have to say thank you. I mean, what an incredible experience. And it on so many levels, oh my goodness. So it's very humbling to watch your words being spoken by another. And so I loved the quote, Dory, that you shared at the opening, that, the equivalent of walking in another's shoes. So that came out so clearly. And I believe I need to hear this or watch this every week. And each week I know I will be equally moved and inspired. And you guys, students, you did such an amazing job. You really, really did. And it's just, you have made such an impact. I know not just on me, but it's such a joy to hear that this link will be shared because others will be moved by these stories. So thank you so much for the invitation. Thank you, Rosie, for the invitation to be involved. And thank you all for your incredible work.
Father Gregory, do you have anything you wanted to say?
Sure, Sister Judith, thank you.
Emma?
With each of you, the insight and the courage that each of you have given to us by letting us share a little bit of what we've experienced, weaved with your own stories. I think one thing so unique about stories is it touches us in a very different way, and it really helps us to find bridges. Like Emma, who knew that your name and my grandma, I mean, all these not coincidences, it's really grace. It's just a reminder how loved each of us are, especially when we feel so isolated and separated or segregated during these very challenging times. And I think to Nancy's point, what you have shared with us and what you've invited us to walk together in is an experience that will transcend the pandemic because it allows us to walk together with meaning and purpose. So thank each of you. I'd like to, even though you're students, you know, you're really cohorts, your comrades, your caregivers with us. And so thank you for letting us walk in this journey with you, because what you have shared has touched us, and it's the story that will live. And like Nancy, I think we should play this often, because think of how you will touch others. And thanks, Emma, the ring. I'm wearing it. Yay.
There are a couple of other questions. Emma and Michaela, what are your hopes and aspirations around justice stemming from this project? And I would include Emma in that, since she joined us also. Any of you want to respond to this? In other words, has it changed your attitudes towards things you want to do in terms of social justice or whatever?
Absolutely. I feel like the first step to really understanding the issues that people are experiencing, especially marginalized groups, is hearing stories of people that work directly with them. I think lived experience is the best way to motivate people towards justice. And although I've been in social justice, I'm on a service org on campus. I'm not on campus anymore, but this just further increased my passion for, fighting for those who can't fight for themselves and giving a voice to people who don't necessarily have a voice in today's world. So.
Yeah, I think one thing that I really considered during this whole project is I'm a film major at LMU, and I think this really helped me not reconsider, but kind of reevaluate my role as a storyteller during this time of crisis, and the skills and passions and connections I have to storytelling, and how I can use those skills and use those passions in ways for social justice. Because I really do think film, and I think one thing that's unique about film and theater is that it's so much of an experience. And I think one thing that helps us feel more connected to people is feeling like we're sharing that experience. And I think that's one thing that stuff like documentary theater and verbatim theater really accomplishes. It really forces you to look head on at what someone else is feeling and what someone else is going through. Because I think especially now during COVID, it's really easy to isolate and kind of force yourself to like shut out and kind of like, because it with us not interacting with a lot of people, it's in a way, if it's not happening directly to you, it's really easy to avoid it. So I think this whole project has helped me consider picking up topics that scare me and just throwing myself head into them and learning as much as I can and putting myself in the position of listener and then working to become the storyteller. And I think it's really powerful, and I'm excited to pursue more projects like that in the future.
Definitely. I think something that I took away from this project, and honestly just Nancy's story in particular, was that in every situation that just seems horrible and awful and like nothing good can come of it, there is an opportunity there to do good and to spread joy and comfort and really, spread that positivity when there feels like there is none. And to see, these things, these events that seem so horrible as an opportunity to really make a difference and do good. So that's the main lesson I feel like I'm coming away from this project with.
We have just a couple more minutes. Dory, let me ask you if there's anything you want us to, that we haven't done, said, whatever.
I don't know. I'm still being moved by what I just saw for the last hour. But I have to say to everybody that doing the Voices of Justice project for 10 years has made me really, I know this is a weird thing to say, has made me really value documentary rather than fiction. That making things up, I think making things up, there's a place for it, but hearing other people's stories, really listening to the words, just raw on the transcript, teaches us so much about what another person is going through. And tonight, it just all seemed different to me from the time I heard it 3 months ago. And I think that that is a tribute to just this form of storytelling, to the skill of the students, and to the selection of people who were chosen to be in this project. I mean, to me, this is like I would feel after seeing a really good play for an hour. So thank you, everybody, students and participants. This was really a great one.
I also just want to make a special thank you. I think I shared with the storytellers at the beginning that I've actually allowed people to tell my story as a cancer survivor. So I know how vulnerable that is, incredibly vulnerable. So I just want to say thank you to the storytellers who are here tonight. And Rosie, if you'll pass on to be sure that all of them know that we know what a gift that is. And there's something in us that says this must be shared because others are going through these things. And we need to be able to hold hands during this time on that. Yeah. And that having said, I also want to just say how proud we are of the students who took on a really tough thing to deal with when they are in fact, some of them dealing with that in their own homes or work COVID survivors themselves. So maybe I will just allow Rosie and Martin to say anything that they need to close up, or Nancy, Greg, any of you, if there's anything we have about, I think we have a couple more minutes. She'll give us a little more grace before she turns this off. So, thank you. So Rosie.
Darren wanted me to make sure that I extended his thanks to the students. He thought it was a wonderful experience, and unfortunately he couldn't join us tonight. But my thanks, all of you just made this easy. I just, y'all had to do the hard work and chasing people with their schedules and trying to get all that arranged. I just, did the easy part. But thank you so much for allowing me and our organization to be part of this program.
Oh, our thanks to you on that. Yes, no, that's the gift came this way, not the other way.
I think there's an old saying that goes something like, when you receive a gift, it's not just what you have received, but the gift is the hearts and souls meeting. So in many ways, what you have given us are not just your many gifts, which are amazing, but you've given us your heart and your souls, and you've allowed us to share our heart and souls with you. So thank you for bringing us to a deeper way of living and loving. In a time of isolation, you've connected us. So thank you.
All right. Thank you. Anything? I just think that's a nice place to end up, unless Martin, you have anything we need to close with that you have?
But I just say, again, thank you. And to let you know that this is going to improve our way of being healers. So it wasn't just that this was a moment here, but we will use this as a way that we are continuing to be expressions of God's healing. And for that, I'm truly grateful and look forward to what is going to be the next experience with you all. So thank you.
And I noticed, Rosie, you've gotten a couple of requests from different groups to use it in newsletters or whatever. So that is also a gift to us to know that those stories, that the work that these students did will have a continuing life. And we will, of course, make sure you have a copy, and you feel free in whatever way is appropriate to share it with to give those copies to your storytellers as they wish them, and however that privacy works with you guys. So, so at that point, then I think I will wish you all a really good evening. Stay well, stay healthy, stay giving, and we will work together again, Martin. So, all right. Thank you all.
Thank you. Thank you.
Thank you to the students.